Are you struggling with dosage calculations in nursing school? If so, stay tuned because in today's podcast episode of Navigating Nursing School with Your Nursing Tutor, I'm going to share with you a low stress practice plan that is guaranteed to help you break through your procrastination and finally master dosage calculations, even if you have extreme math anxiety. Let me introduce myself if you don't know me already. My name is Nicole. I am a professional nursing tutor. I'm an RN BSN with over 15 years of tutoring experience with nursing students. So I specialize in helping you to find ways to study that are time saving and effective so that you are not always wondering, is what I'm going to study actually going to be on the test? But you will know that the things you are studying are going to help you get solidly passing grades on your nursing school exam so you can get through your nursing school journey as confidently and calmly as possible. And I do have a special gift, surprise, whatever you want to call it, related to dosage calculations today. So stay tuned to the end of the episode. I'm going to tell you how to get that. So the first thing I want to talk about today when it comes to dosage calculations is it's challenging. I want you to know that, okay? There's nothing wrong with you if you've struggled with dosage calculations up until now. And it's often a bit of a shock to nursing students. And even if you're pre-nursing here, you may not know what I'm about to tell you, that most nursing programs have a required dosage calculations exam that is often within the first few weeks of nursing school. And you can't expect them to teach you how to do dosage calculations. And if that's not enough, then you also, in a lot of programs, you have to get as high as 100% on that dosage calculations exam. Now, the passing score does vary a little bit. Some programs say you only have to get a 90. Sometimes I'll hear as low as an 80%. But I would say that most commonly, most nursing schools will require a 90 to 100% on your dosage calculations exam. They may or may not teach you how to do it. Like I just had a tutoring student the other day who told me that she came to one of our group tutoring sessions because she's one of my group tutoring members. And she said that her school gives them a test on the very first day of her second semester. And so obviously they didn't teach anything before that because it was the first thing she did when she got to class, and that they were going to be giving her a dosage calculations exam every single week this semester, and that she is not allowed to pass meds in her clinicals unless she passes her dosage calculations class. So guess what? I'm sorry, her dosage calculations test. So guess what that means? If you can't pass meds in your clinicals, that means you might as well not go to clinicals, which means they're probably not going to let you go to clinicals if you don't pass dosage calculations, which means you're going to fail your semester because clinicals is obviously a required part of your nursing class. This is how important dosage calculations is to you. Now, if that's increasing your math anxiety right now, take a deep breath. Take a deep breath. That's why with my members, my tutoring members anyway, I always work with test anxiety because I have some test anxiety techniques I teach, which maybe I'll do on a future podcast episode with you guys, but to help bring it down a notch. But the best way to get to pass this is simply to just get good at dosage calculations, which you're probably like, easier said than done, Nicole. I'm allergic to math, or I've always been bad at math. But I'm telling you, I hear this every single day from all kinds of nursing students. But you know what else I hear? I hear people who learn my dosage calculations method. They practice it exactly the way I tell them to practice. And just a couple months later, they're coming back to me saying, you know, Nicole, I never thought this would be true, but I am actually finding that it's fun to do dosage calculations. It's kind of like doing a puzzle, like a logic puzzle or something like that. And it's actually fun for me now. And I even have some classmates who are coming to me asking me to tutor them on dosage calculations. And I'm always asking them, like, well, are you tutoring them? What are you going to do? They're like, heck no, I don't like math that much. Okay. It's not a miracle what I do, but they're like, I don't like math that much. I just refer them to your nursing tutor, which is great. I love it when you guys refer people to me because I love helping nursing students. This is my passion. But the point is, even if you don't like math, you can come to like dosage calculations. And even if you don't like dosage calculations, you can be confidently able to do them. And the way I teach can take as short as a weekend, honestly. But today I'm going to share with you my biggest tip. So whether you ever learn my method for dosage calculations or not, this is going to work for you no matter how you choose to solve dosage calculations. And that is my practice plan. And I'm going to tell you why this works and why you need this. It's because the biggest barrier for you to learn dosage calculations is yourself. I tell it like it is in love as a tutor. Honestly, I think I'm more of a nursing school coach than a nursing school tutor, I always say, because nursing school is such a mind game. It's all about mindset issues too. But here's why. It's because when you have these thoughts that you're not good at math, and it feels intimidating, it feels like there's a lot riding on this dosage calculations test, because there is, and you feel like you're going to be bad at it, we tend to avoid the things that we don't think we're going to be good at. We tend to avoid the things that make us feel icky. That's an official term, icky, right? And that's normal. That's just human nature. It doesn't mean there's anything wrong with you. But what it does cause is procrastination. And procrastination is the number one thing that's going to prevent you from learning dosage calculations, because this is what happens. We don't like math. We don't want to practice. We don't think we're going to be good at it. We feel confused by it. So we don't do it. We find other things to do to keep ourselves busy. And that's super easy to do in nursing school. Everything else seems like a priority. But now the dosage calculations exam is coming up. Maybe it's next week. Maybe it's a couple days from now. And time is running out. And now we have to. And so you practice a little bit. It's stressful. Still doesn't feel good. You take your dosage calculations exam. Hopefully you pass. Maybe you don't. You have to retake it. I think I forgot to mention that most programs will allow you to retake it for a total of maybe 2 or 3 times before just failing you for the semester. But make sure you know your program's requirements. And when you pass it, if you eventually pass it, you just stop because you're like, oh, phew. Don't have to worry about that anymore for a while. But you do have to worry about it again, because you're going to get another dosage calculations exam, maybe next week, maybe next semester, or maybe you're going to get dosage calculations on your exit exams or on your NCLEX even. It could pop up. This is a skill you have to master. And so what if I could tell you that by following my practice plans, you could get to the point where dosage calculations are no longer stressful for you, but instead they become free points. So you see one on your exam, and instead of feeling anxious, you feel excited because you know you are going to get this question correct. That is what this is going to do for you when you do the practice. Because when you practice consistently, you will eventually master the skill. Now, the method you use to solve this caveat, okay, there's different ways you can learn to solve dosage calculations that will speed up your learning curve. The way I teach is the fastest way that I have found that helps. But even if you use formula method or whatever other method you've been taught or what you've tried to learn or what you feel comfortable with, this practice plan will work for you too. It just might take a little bit longer, but it'll work. And here's why it works. It has to do with our neurons and the way our brains function. So our neurons are amazing in our brain because they're very, very efficient. And when we go to learn something new, whether it's a new skill or a new fact or whatever, this is true of everything you study in nursing school, by the way, which is, again, why it's like a big reason why my silver bullet study system works, if you've ever heard me talk about that before. But the way our brain will operate is if we're trying to learn something new, our brain notices we're learning something new. It's like, aha, we're learning something new. Let's create some new neuron connections. Obviously, this is the simplified 4th grader version of the explanation, right? But that's what we need to know. The neurons are like, okay, let's make some connections so we can remember this. And it starts to make these connections on dosage calculations because you're cramming, you're trying to like squeeze in some practice before your dosage calculations exam. Then you take your dosage calculations exam, and what do? You do what everybody does. You brain dump. There's a reason why it's called brain dump. You stop practicing because you don't like it, you don't want to do it, so you stop. And when you stop, your neurons are getting a new message now. They're saying, hey, you remember those neural connections we made last week that we thought were important? Yeah, well, it turns out they're not important after all because we're not using them anymore. So let's get rid of those. And they disappear. They're gone. So the next time you have to do a dosage calculation, the next time you have a dosage calculations test, you're starting from ground zero. You have to start from scratch. And that doesn't feel good either, right? And so this is what makes you think that you're bad at math, but you're not bad at math. You're just bad at practicing. You're bad at practicing, which again is a normal human condition. It's a normal human condition. But there are tricks that we can use to make practice easier for you so that you can have a better experience with dosage calculations. And here is the number one trick. You have to pre-decide on a realistic practice plan. You have to pre-decide on a realistic practice plan. This is how you manage to get a low stress approach to mastering dosage calculations, okay? And I'm going to tell you exactly what to do. I'm going to give you the practice plan. Now, there's more details to it than what I'm going to share today because I don't want to just me brain dump it all on you. But I have the full practice plan available for free on my website. If you just go to yournursingtutor.com/DC. That's DC, like dosage calculations, the first letters of dosage, the first letter of calculations. So it's yournursingtutor.com/DC. And you can just fill out that form and I will email you the full practice plan. There's actually 2 practice plans. You can choose which one works best for you, whether you have your dosage calculations exam coming up next week or whether you have it coming up like a month or more from now. Either way, you can feel more confident with these practice plans. So here's what you need to do. I recommend that you simply do as little as 2 to 3 practice dosage calculations per day for only 5 to 7 days per week. Okay? You're like, only 5 to 7 days per week. I know, but it's only 2 to 3 practice questions. If you sit down and do those, it's only going to take you like 20 minutes. 20 minutes. Now, if you're coming home from a long day of clinicals, if you're coming home from a long day at work, or you've just been like running your kids around to sports practices and stuff like that, and you get home and you sit down to study, you're not going to be like, I know I said I was going to study dosage calculations for 2 hours, but I don't want to do that. And then you're going to do something else because it just doesn't feel good to do that. There's no motivation to do that. But if you've pre-decided, like, I only have to do two practice questions, it's only going to take me like 20 minutes. And then you sit down, you're more likely to do that. So it's a lower stress, pre-decided practice plan, makes it more likely you're going to stick to it. This is true of any kind of new habit you're trying to start. Now, when you do this, though, here's the other part of the trick. You can't only do it before your test, especially if your test is coming up like next week, because you need to do a longer term. You need to be doing this way for at least a month. And I don't care where your exam falls in that. Like if your exam is the first week, I don't care. Keep practicing 2 to 3 questions per day, 5 to 7 days per week for 3 more weeks after your test. If your test is next month, great. You get to do all the practice before your test. That's fine. Now, but you need to do this for a minimum of 30 days. Minimum. At the end of the 30 days, you simply reevaluate. Okay, you're going to reevaluate and say, hey, do I feel confident? Do I feel confident? If the answer is yes, I feel so confident, it's like riding a bike, I'm never going to forget this, then guess what? Now you get to quit practicing because you have told your brain that those neurons are important. Those neural connections are important and that you should not get rid of them. But if at the end of those 30 days, you're like, I've hated math for 30 or 40, 50 years. I don't think 30 days of practice is enough. I think I would feel a little more comfortable practicing it longer. Then you practice for another 30 days and you reevaluate again. This is part of the nursing process, right? It's like you're implementing this plan. You're assessing where you're at. You're making a plan. You're implementing the plan by practicing. And at the end, you evaluate, have you achieved the results of your plan? If you have, you can quit the plan. If you have not, you continue the plan or make any adjustments. And you just do this until you feel completely confident. This will help you with dosage calculations. This will turn dosage calculations from a stressor in your life to something that's actually more reassuring. Because like I said, you're going to get guaranteed points on any dosage calculations question from now on if you just master this skill. And it really is like riding a bike. So it's like math, dosage calculations is not going to change between now and when you graduate. It's the same. So if you learn it now, that's one less thing you have to learn later because you've mastered it. Now, if you feel like your weakness is not the practice plan, well, I'm gonna tell you, your weakness is the practice plan. Okay, I love you, but your weakness is the practice plan. But if you also have another weakness, which is, again, very, very common for people to have multiple weaknesses in the area of mastering dosage calculations. If you feel like you don't know how to solve the problem in the first place. So you're like, well, that's great. I can sit down and practice, but I can't get that question right. I don't know how to get that question right in the first place. That's a slightly different problem. I can help you with that. I have a dosage calculations jumpstart class. So it's basically an on-demand class you can watch. You can purchase it separately. It is also available in my group tutoring membership. If you're very nervous about dosage calculations, I would recommend joining my group tutoring membership to get access to it, because that way you can come to our weekly group tutoring sessions and get a pep talk from me, ask me questions. But really, for people studying dosage calculations in my group tutoring membership, the biggest benefit is our members only forum, because you can, anytime you get stuck on a problem, you can literally take a picture of it, upload it to the forum, and say, Nicole, I'm stuck and I don't know what to do. Show me your work, because I can look at your work and in like 30 seconds, I can explain to you kindly and lovingly exactly what you're misunderstanding. And I can tell you what you need to do the next time you get a problem like that to not get stuck. And believe me, it is easier than you think with the method that I teach, because I do not use formula method when I teach students, because I frankly hate formula method. I think it's the type of thing that gives you a false sense of confidence in the beginning, because when you're just learning and you don't like math, you're like, great, I don't have to think about math. I just have to memorize the formula and plug things in. And it works okay for like the easy problems. But then as you go through nursing school and you get more complicated dosage calculations, like weight-based calculations and things like that, then, and you have to do like multiple conversions and stuff, then if you're relying on formula method, it kind of breaks down and you end up not feeling confident, not doing well with it, and struggling when you didn't at the beginning. The method that I teach, it's not, you don't have to memorize multiple formulas. It's literally one way of doing it. I teach a 6-step process. You follow 2 rules. There's only 2 rules to follow. Everybody can learn 2 rules and follow 2 rules, right? You follow those 2 rules as you go through the 6 steps, and I guarantee you will never get a dosage calculations wrong. I don't care how simple it is. I don't care how complicated it is. The same process works for any type of dosage calculation. So if that sounds good for you, then you might want more than just the free practice plan that I'm offering, which again, you can get the free practice plans at www.yournursingtutor.com/DC. Okay. Because that practice plan works no matter how you solve dosage calculations, but it's going to work faster if you use the method I teach, if that's something you struggle with. Now, if you're listening to this today and you're like, I don't have any problems with dosage calculations, it's fine. Like, I don't need to learn a new method. Well, good. That's awesome. I'm glad. And I always say, if it's not broke, don't fix it. If you're not having problems and you feel confident, why are you even listening to this episode? Go on to the next episode, right? But if you don't feel confident, even if you're getting most of them right, but you don't feel confident about it, you want to feel 100% confident with dosage calculations every single time. Okay. So you might want to look into a new method that way. But in the meantime, make sure you're practicing and let me know how you do on your next dosage calculations exam. While we're on that topic, I would love it. I would really appreciate it if you get any value from my podcast. If you find them helpful, tell your classmates about it, tell your instructor about it, but also go over to Apple Podcasts for me real quick and just leave a 5-star review. If you're able to also, write a few lines about something you've gotten or learned from this or what this podcast means for you in nursing school, I would really, really appreciate that. I love reading your reviews and hearing what you have to say and where you're at on your nursing school journey. So I always appreciate the reviews on Apple Podcast. So hope this is helpful to you today. Get started on your dosage calculations practice. Start creating those neural connections and keeping there long term. And as always, good luck on your nursing school journey.